Ulifika la dichaba. Moyemedi. Is it shooting? Oh yes, it is. Shooting Nike. Ulifika la dichaba. And it gets on my phone now. I have to talk to my people. But I make you hot enough. Am I hot enough to shoot content, honey? I hope my English has improved because I've been gone for how many months? Like it's been long, guys. It's been very long. Hey, woo. Okay, let's start.
Yasmin. Yes. Woo.
I'm getting ripped tonight. R.I.P. my mental health. Ooh, medical school, let's get sickening. Oh, grrr. Yep. That one.
Tuh, Sanya.
Yeah.
Oh, the drama of it all.
Hi, darlings. Welcome back to my YouTube channel. If you are new here, welcome, honey, to this dysfunctional family. My name is Katlotha Makhale, and I am your certified official mediocre of the century, darling. In today's video, as you've seen with the title of the video, like it's the only thing that I do. I talk about all things medicine in a certain way or manner. Yeah. We are having the reality of medicine itself. So we are recapping, if that's a word, on the whole shenanigan, the whole chende, the whole drama with medical school. We're going to reflect mainly on block 4B, which I did previously before this vlog. I just finished with another. I don't know. Man, I'm too much. Can I just calm down? Like this is a lot. Katlego, you need to try and calm down a bit. So guys, we are having a recap of what's been happening in my life academic wise. Like, a lot has been happening. It's been 3 months since I did a video complaining about medical school. So I just had to come back and do what I'm good at. Right. So let's start with this current blog that I just finished right now. Or I don't even know whether I finished it or not. Um, because the test was like was very fun. It was nice, I guess. So this blog we call it GNK 283. Um, child. So this was a very useful blog. I learned a lot. I gained a lot of information that will help me in second year. And the content that was given, it was relevant. That I had the capability to answer today's questions that were asked in the test. It was quite a nice blog. Like, lectures were communicating with us, like lectures were narrated. um it was quite a nice blog. Lectures were available. It was a nice blog. We had an assignment. It was like we were not confused at all. We understood what we had to do. It was explained clearly. Everything was just squeaky clean. Like, come on, guys. We can't always complain about school. Everything was just fine with this blog. I loved it. Anyway, we are done talking about this blog. What was actually nice about this blog, like honestly, ooh, sorry, what a lady. This blog actually, from my own understanding, this blog, um, uh, it was. This blog, I feel like it was meant to introduce us to different specialities in this degree, right? In this career path or field itself. Do you understand? So it was supposed to give us information, clear information of after finishing this degree, you can specialize in this. So in this degree, we deal with this. In this specialty, we deal with um, eyes. And when we deal with it, if it's ophthalmology, we deal with eyes. We deal with surgery of eyes. What's the difference between optometrist and ophthalmology and other optician, what, ocular, what. So I feel like it was supposed to teach us those things. And then the assignment was talking about clinical things. It was talking about consultation. I'm like, guys, are we doing ethics? Are we doing what is expected of us in this blog? I had no idea. I had no idea. I also thought that the test, since the lecturer said that it will only be general knowledge, there's nothing to worry about. It's quite a chilled blog. I thought that they're going to ask us of, okay, ophthalmology, what is supposed to be, what are you supposed to know about ophthalmology? Give us questions on I thought they would give us questions on that. Like, for instance, pediatrician, what is it all about? I'm dealing with children. You know, because most of these lectures, or the overall idea of these lectures, I think they were based on specialties that are in this degree. But even to date, I don't understand what's going on. I am so confused. The questions. Okay, let me not scare you guys who are behind me and who are still going to do second year in UP. Um, just know that you are going to do useless blocks. That's the reality of the story. That's the reality of medical school in our beloved university. You are going to do blocks that you don't understand why. Sometimes this block made me feel like my beloved university is trying too hard. They're like, man, give them something, man. They need to be busy all the time. They don't need to rest. They have to do something, man. Give them something, man. We just want the money. Yeah, give them something. We need to make them, always active. They need to always stress. They need to always read. Yeah, so we are done with block GNK, what. Let's talk about the main character here. Let's talk about what I wanted to talk about, which is block 287. Okay. I had the most eventful 5 weeks of my life. Block 287, what does it entail? This blog was all about bacteria, it was all about viruses, it was all about pathology, it was all about, did I say pathology? Parasites, I meant. It was the study of mycology, which is fungi and whatnot, the study of bacteria, microbiology. Yeah, it was microbiology, medical microbiology. Do you understand? So it was all about that. And what did it give me? What is the end result of this blog? Paranoia. I am paranoid, darling. Everything is a disease. Everything is just a disease. I cannot. Even now, when I'm thinking about breathing, guys, my eyes, I cannot. Everything is a disease. So, we got to understand how certain diseases, most of the diseases are infectious. They are they are all infectious. The diseases that we dealt with in this block was infectious. Now let's talk about what I enjoyed. Why does this block make me happy? Um, for the first time in my life, I can be positive about this blog. Blog 284. This blog had nothing to do with other sections. Like we did, if it was microbiology, it was only microbiology. There was nothing like, hey, histology come through. Hey, yes, there was pharmacology, but the pharmacology was specific. It was specific on the treatment of these microorganisms. Microorganisms, I mean bacteria, viruses, and whatnot. So we had to learn about even our current bitch, Miss COVID, Miss Corona, Miss Corero. It is called Corona because when you look in the microscope, it looks like a crown. That's why it's called Corona, guys. So we learned it was a beautifully structured block. I don't wanna lie. I learned so much and I am so paranoid. I am very much paranoid, honey. Everything is a disease. I was always on my phone telling my father that be careful. Tell my little sister, my little brother that they shouldn't walk barefoot because there are worms that invade your skin and cause diseases, honey. So yeah, it was quite a nice blog. Um, um, we learned a lot, guys. We understood why even the vaccination for corona came so fast or so quick. It is because that coronavirus isn't a disease of now. No, this is SARS-CoV-2. Have you ever thought why is it two? We had SARS-CoV-1, which was more a bit lenient years ago. I think it was 2012. I don't remember well the years. We had this, and we also had MERS-CoV, which was also part of the coronavirus. Do you understand? So it's a virus, coronavirus, which causes diseases such as SARS-CoV, MERS-CoV, and SARS-CoV-2. This it's called COVID-19. That's a disease. The virus that causes this disease, it's coronavirus. So we were able, not us as medical students or I mean medical doctors, we are not the ones who actually implement or rather come up with vaccines. No, don't look at us and be like, oh, doctors, they are sitting, we don't have an HIV vaccine. We are not the ones who create vaccines. We are the ones who administer the vaccine. Do you understand? Oh, the English, the medical English, guys. It's so nice. It's painful to study, but it's nice to have knowledge about these things. I feel like I am becoming an angel. I'm too hyper today. I don't know why. I'm excited but yet pissed. But I am trying to be positive, but positive in a negative way. Not negative. This is not being negative. This is being real. We can't always be positive and trying to be other people's idol. I don't want to be your role model. I don't want to be. Those are big shoes to fit. I can't. So I'm going to be real with you and tell you that medical school, it's the pits. Medical school will test you in all aspects that you never thought that you'd be tested in. Even today, I don't trust myself because of medical school. I don't trust my intelligence because of medical school. I'm always in this tetanus form. I'm always scared. I'm always like, what if I fail? What if I don't do this? Do you understand? Sometimes you study or during studying, you're like, what's the use? You're still going to fail because questions that they ask those nitty gritty questions, those smaller things that you never thought that they'll ask. Do you understand? So medical school, it's toxic. Medical school, it's toxic to a point where it transforms you. Sometimes you might act like a bitch, but you are not, because it takes out the life in you. It takes out that essence, your aura. It takes out. You end up being this effing monster. Yeah. So don't mind us sometimes when you ask something and we become brutal. It's not us, it's the degree, and sometimes we might not be there emotionally because our emotions are sucked out of us because of this degree and what we learn. Okay, back to what we were talking about. So yeah, microbiology was all about bacteria. Guys, we learned about bacteria. It is everything is a disease, guys. When you cook, please cook properly. Cook properly. Make sure that your food is properly cooked. When I see seafood, I cringe a bit because I'm like, did you cook these things properly? When I see those octopus being eaten and those, I'm like, guys, no, no, no. Chicken makes me cringe at some point. I'm like, you need to be cooked. So cook your food properly. Everything causes a disease. Do you understand me, guys? Like everything causes a disease. Even your fecal. There are diseases that come from your fecal, your feces. I meant fecal root. Like it's a lot. It's a lot. I'm so paranoid. Everything is a disease. Everything is a disease. Don't walk barefoot, guys. Make sure that you. Even now, when I think about eating an apple, I'm like, I feel like rinsing an apple doesn't make it clean enough for it to be edible. I feel like I should use dishwashing liquid, jig, I meant bleach. I need to use Domestos to wash this apple before I can eat it. I need to disinfect. I need to sterilize my food. So it's a lot. It's a lot. We dealt with a lot of things. And when we get to viruses, okay, these ones are very dangerous. We saw penises that look like saxophones. Guys, imagine your male genital being bent and deformed like a saxophone because of a bacteria or a virus. Guys, don't but guys, please protect yourselves. We are dealing with a lot. I was in a lot of pain looking at sexually transmitted diseases. STIs are dangerous, guys. So be careful of sex. Yeah, now I do understand why God was like, hey, when Eve, do not eat from that tree. It's the tree of good and evil. And Eve was like, no man, I'm going to eat. And now guys, it's painful. Like I cannot. Even now when I'm thinking about the diseases such as Neisseria gonorrhea. Guys, take care of yourself. Especially in our generation, we are normalizing this thing of I need to have multiple partners to for a multiple questions has to have multiple answers so that I can choose the correct answer. Choose the correct answer safely. Safely. Condomize and also oral sex, guys. Oral sex also you can get these sexual transmitted diseases through oral sex, such as labilis, labi, yeah, yeah, those diseases, guys. Things we see in medical school, things we see now. Imagine I cringe, I become uncomfortable, I become like this just by looking it in the lecture, in a paper, darling. What if real life? What's going to happen if I see it real life? Ke tlo go fainta, nka screama gore ko screama. Listen, I'm going to scream. And these, they have bad odor. Already I was imagining the odor. I'm like, guys, no ways I'm going to deal with this for the rest of my life. Like, ever since I started with microbiology, I've been cutting off the specialties that I'm not going to do. For now, I don't want to do gynecology and obgyn. I don't want to deal with children because of there was the lecture on GNK 283 where they were like, you need to be a hostage negotiator. Patients like children, they don't know how to explain their pain. So now I have to predict why are you sick? I have to deal with children for 27. I cannot. So those kind of things, like Yo, guys, I don't know what I want to do, but I still love cardiology. I still love cardiology. Yeah. Microbiology made me reflect, use my information and reflect on my family members who have already passed on. You know, in public hospitals, like, we don't get quite information, or why did she die? We want to know the whole information. They are like, okay, she died. Like, they don't give you that information. I love this degree. This degree makes you learn so much in a painful way. Anyway, but it's quite a nice degree. I would suggest that you do this degree, but when make sure that you know that it's not going to be easy. It's not going to be easy, and there are some times where they don't give you that space. They don't give you that um not area, the opportunity of failure and learn from your failures. You always have to do whatever it takes to pass at least 50%. You know, I don't know when last did I get a distinction. Do I make sense? I hope I do make sense. Yeah, it's now 24. But oh Lona, I've been talking for quite a long time. What did we learn today, children? What's the moral of the story? The moral of the story is that medicine, it's not easy. Medicine, it's quite an adventure. Medicine, it's Jumanji. It's chaotic. It's a toxic environment. It's a loving career field. It's Don't come to medicine if it's not your passion. Don't come to medicine if you don't dream when you are studying a lecture and then you just fantasize about you already examining patients, you diagnosing patient, you prescribing medication. You understand? So yeah, it's a degree that takes a lot in you. It takes a lot in you. This was an eye-opening vlog. I don't wanna lie. I enjoyed, but yet it was very painful vlog. I failed. Yes, I did fail. Um, what I loved about this blog is that they gave us daily assessments. So I had to wake up every morning and study because at 4 o'clock I had a test every day. So um, on the darker side, it was painful because I don't like studying every day. Do you understand? I hate studying every day, and I hated myself on each and every occasion. You understand? But on the brighter side, it prepared me for what to expect on the semester test that we had. They gave us a lot of time for those daily assessments, but they were there for us to assess our progress and to assess our knowledge in these viruses and the content itself, you know. And then in the brighter side again, I learned so much. You might feel that you don't know anything, and then Papa, but when you have a little bit of light, you have an idea, and then you Google and you're like, okay, to confirm your knowledge, because it's a little bit blurry. Do you understand? The content is just blurry. You are just taking pieces and joining them together. Like, I feel like first year and second year, I don't know about third year because I'm still in second year. It's a mess. Just know that first year and second year, it's a mess. The only thing we are striving for in this degree is to pass. I'm at a point in my life where I just want to graduate. I am so over this degree. I don't like this degree. I don't like being a student, but I am obsessed with being a medical doctor. I might hate people with all my heart, but I really want to save lives. We are going to deal with root patients, and I hope that this medical field accommodates us and try to understand that we are also human. We also have feelings. This thing of I know I don't have much information. I'm taking this from other people's experiences. The likes of Dr. Oyama talking about patients who are rude and the hospital not supporting doctors. So that needs to stop. That needs to stop. We are also human beings. Being professional doesn't mean I don't have to show my emotions. I don't have to show my depression. I don't have to show my personality. Imagine me not showing my 100 personalities. Don't you think that I'm going to be a boring doctor? Imagine you sitting there and I'm like, but when I'm not saying that. So we still have a long way to go. Just know that this degree, it's not roses and it's actually trash. This degree is trash. But with this trash, we can recycle it and make beautiful things. Anyway, please do subscribe to my channel. I think I am done for this video. Guys, do subscribe to my channel. It was nice talking. Like, you can see in me that I am so excited to be in touch with my creative side again. It's been long. It's been very long. I'm sorry for the hang dances and whatnot. It's not me. I just love, opinions. You know everything. Anyway, thank you so much for watching this video. Don't forget to subscribe. Don't forget to like. Don't forget to hit the notification bell. Guys, I want to be monetized. Like, what do you think about that? Like, I have to be monetized. Like, I'm creating content. I am a creative. I am the girl that I think I am. And I don't know why are you sleeping on me, because you have to subscribe to my channel. You have to make me monetized. I don't know why am I still stuck on 400 and something. Oh guys, I have to thank you. From 300 for years, I've been on 300 subscribers. I'm finally on 400 subscribers. Thank you to all the new subscribers. I love you so much. Anyway, don't do that, guys. Subscribe to my channel. I'm quite an entertainer. And don't look at me and be like, a medical student, I'm supposed to be like this. No, I'm an entertainer, darling. When I'm on YouTube, it has nothing to do with my career or the career path. No, don't. Yes, I'm going to talk about medicine, but it doesn't mean that medicine is my personality. Don't do that. I am a creative. I am a medical student part-time, but I am a creative full-time because I'm always fantasizing. I'm always thinking about ideas. Oh, my English has improved, guys. Like, I don't know. Like, I'm not doing anymore. Or is it because today it's a beautiful day and I try to look stunning? And I'm also drinking Coke, so it's giving me a lot of caffeine. Okay, guys, bye-bye. I love you so much, and I hope that you get well soon. For those that are experiencing depression, I hope that I try to make you laugh. I try to brighten your day. And with that said, bye!